This is my midterm diary entry, which I'll discuss two major lessons that I have learned so far in this course that will influence my nursing practice as a registered nurse. So I'm just going to take you back a little bit. In February 2020, I was chosen to join a medical team abroad to provide medical care in Quito, Ecuador. And volunteering as a student in an impoverished country was a constant reminder of the available luxuries that we take for granted here in Canada every day. I brought back an appreciation of our valuable resources and developed a better sense of empathy for countries that have significantly less than us. What I took away from this experience was that I discovered some of the richest and purest of hearts in some of the poorest people. And from then on, I vowed to myself that I would return to Quito, Ecuador as a registered nurse to help those who are equally deserving to be valued and given the opportunity for the best quality of life and greater accessibility to healthcare. Now, we're going to fast forward exactly 2 years later, and I'm now taking this class, Nursing 437. So in Unit 2, we talked about health promotion. We explored and identified appropriate determinants of health related to health disparities and inequities to optimize health outcomes for individuals, families, groups, communities, and populations. And one of the learning resources that resonated with me was the video by CBC News called "Canada's Struggle to Provide Healthcare to Northern Communities." This video changed everything for me and gave me an insightful and significant aha moment. It's incredible to watch the resiliency of these people living in such remote areas. For instance, families having to travel many miles just to receive basic health care. And after I watched the video, I kind of felt a sense of ignorance at the lack of consideration surrounding the struggles of many Indigenous populations who live in such remote areas in Canada. I honestly asked myself, why do I need to travel all the way to Quito, Ecuador, when my own country has major health disparities and inequities related to geographic barriers? It's one thing to read about these disparities, but visually seeing the realities of health disparities and poor living conditions it's like super eye-opening. And the video alone gave me the smack in the face that I needed to realize that Canada is not immune to health inequities and disparities. This self-reflection has validated my passion and my commitment to delivering culturally safe and equitable care to marginalized populations. It's made me realize that I don't have to travel across the world to fulfill my nursing goals. In fact, it's encouraged me to explore nursing opportunities in remote and Indigenous communities. Also, from an individual standpoint, I cannot undo the harm that colonialism has done. However, I, as a non-Indigenous Canadian, can dedicate my nursing career to help dismantle the legacy of colonialism and promote reconciliation in my own nursing practice as I transition into the role of a registered nurse. Okay, the second most significant takeaway from this course so far is from Unit 5 with the professional boundaries. As nurses, we tend to think of ourselves as fixers, and I know I'm guilty of that for sure. Sometimes it's a good reminder that we can't always infringe our beliefs and values on our patients. A good example of this is vaccine hesitancy, especially regarding the COVID-19 vaccine. The struggle has been real regarding vaccine hesitancy, especially in the last few years. I've learned to stop and self-reflect and ask myself, are my feelings and actions more about me? And if the answer is yes, then I've learned that I must switch my trajectory to set firmly on the client I intend to support. So keeping a professional boundary includes meeting patients where they're at and respecting their decisions. It's important as I transition to a registered nurse that I'm not only aware of my own attitudes and behaviors, but I'm also aware of my clients. I've learned that actively listening to my clients regarding their fears around vaccines can sometimes be helpful in building that therapeutic relationship to the point where they'll trust you. Having that trust is super imperative because together we can then combat some of that misinformation with evidence-based facts. Nurses can learn a lot about our patients when we just listen. Listening can nurture the patient-nurse relationship, thereby creating trust. And when our patients trust us, compliance regarding treatment and medication usage improves, resulting in improved patient outcomes. So these are just two of the biggest takeaways that I have in this course so far, that will definitely impact my nursing career in the future. Thanks.